experts, which I first would like to introduce. First, Michal Rataj. He is graduated from the Faculty of Computer Science at the University of Silesia. As a patient, he is actively involved in patient organizations for over 20 years. He is an ex-board member of the European Patients Forum, EPF, and he represented the EPF in the Patients and Consumers Working Party within the European Medicine Agency, EMA. Through the EMA, he is involved in various projects such as a digital media working group, electronic product information, vaccination, and more. And he is also vice president of the Polish Neuromuscular Disease Association and external advisor of the European Alliance for Muscular Dystrophy Association. His statement for tonight is: data processing in the health sector cannot take place without the active participation of all involved stakeholders, including patients. Access to one's personal data, transparent information about processing, and the right to be forgotten or to erase data should be respected in every step of the life cycle. Michal Rataj, I'm happy to have you here.
Hello, everyone. Thank you for the introduction.
Now, I would like to welcome Dr. Sonia Shaikh. She is an assistant professor at the Amsterdam School of Communication Research at the University of Amsterdam. In her research, Dr. Shaikh focuses on the impact of artificial intelligence and digital technologies on human decision-making, organizational behavior, and policy in the sector such as healthcare. Her research has been funded by Microsoft Research and the Fulbright program. She also served as a consultant in the World Bank in Washington, D.C. Her statement for tonight is: stakeholders in the health sector have competing interests that influences how health data are processed. Among all stakeholders, the public is an uninstitutionalized entity, and their interests are more likely to be ignored and sidelined. Data processing in healthcare should explicitly focus on maximizing freedom for the public by outlining the competing interests of various stakeholders. Sonia Shaikh, welcome to our evening. Nice to have you here.
Thank you, and nice to be here.
Now I would like to welcome Dr. Giuseppe Fico. He is assistant professor of biomedical engineering at Universitat Politecnica de Madrid and is responsible for the health area in the life supporting technology group at UPM. He is currently the Secretary General of the European Alliance of Medical and Biological Engineering and Science and Technical Manager of European large-scale pilots demonstrating the usage of key enabling technologies such as artificial intelligence, 5G, Internet of Things, and robot for the hospitals of the futures and chronic diseases through digital transformation. His research interest includes artificial intelligence and data-driven decision support systems for health, human-computer interaction, and health technology assessment. His statement for tonight is: the challenge is understanding the real meaning of providing European patients, citizens, and professionals with a secure and protected environment for primary and security usage of health data. Welcome, Giuseppe Fico.
Good evening, everyone.
Now I would like to welcome Professor Dr. Seldag Günes Peschke. She is head of comparative law at Ankara Yıldırım Beyazıt University. She's graduated from Ankara University Faculty of Law, and through the scholarship of the Italian government from 2000 till 2001, she did her PhD research at Roma La Sapienza University. She had a lot of research stays in Germany supported by DAAD, the German Academic Exchange Service, the Max Planck Institute for Legal History and Legal Theory in Frankfurt between 2006 and 2012. And she is an active mediator and trainer under the Turkish Ministry of Justice. She works mainly on this media law, data protection, research integrity, privacy ethics, family law, and women's study. And accordingly, her statement for tonight is, because of the lack of sex disaggregated gender data, it was difficult to respond to the specific needs of women and girls during the pandemic. And yeah, welcome, Seldag Günes Peschke. And last but not least, Professor Dr. Karl-Nikolaus Peifer. He is currently Director of the Institute for Media Law and Communications Law at the University of Cologne. He studied law, economics, and Romanic languages at the universities of Trier, Bonn, Hamburg, and Kiel. He holds positions at the Max Planck Institute for Intellectual Property Law in Munich and various universities in Germany. He also serves as a judge at the Court of Appeals in Cologne. His main fields of research are intellectual property, media, and data protection law. And accordingly, his statement for tonight is the flexibility of general data protection regulations, shortly GDPR, with regard to public interest works within the GDPR, but not smoothly when it comes to the transfer of data to third countries. The worldwide dimension of a crisis is therefore not incorporated in the GDPR. Very interesting topic, and welcome, Karl-Nikolaus Peifer. Nice to have you here.
My pleasure. Thank you very much, and greetings to everybody.
Thank you. Yeah, and as I already mentioned, we want to discuss this topic of data protection, data processing in the health sector. But of course, we would like to give you also as guests the opportunity to participate in two ways. First of all, my Isa und Schmidt team is so kind and will collect the chat questions from you and give it to me, and I will ask according to that. Please apologize when I cannot consider everything, but I would like to do that, and with Mentimeter. And this is in fact a poll tool, maybe you know it, and I would like you to take your smartphone now and scan the QR code if you have a QR code scanner, or enter in to your web application www.menti.com, and when you are there, please enter the code 13301872. And I keep it a little bit so that you have time to enter your codes. I see 8 are already coming, 9, 10, super. And while you are going inside, we keep it, maybe we keep this slide a little bit, but I would like to read already the question what I have for you. This is, how much do you trust in the healthcare system of your country regarding data processing? So in fact, we keep it a little bit. I see that there are increasing participants. But in a few seconds, I would like to open the site. I think, Max, you can open it now, and let's start the poll. So this is in fact a scale. You can decide where you put it. Do you strongly distrust or strongly trust? And I would like to know, how is the situation for you? So we see already a curve, or yeah. So it is expectable. Some do, some do not trust. But at the moment, there is a little majority of trusting, I would say. So it is in fact 2.3. No, it is not from the average, it is more distrust. So it is in fact quite balanced. But what we see, we can maybe unshare the screen now. What we see is that there are still a lot of people who obviously do not trust their health system. And this is what I would like to set the focus on that, and would like to ask Michal Rataj. You mentioned in your statement data processing in the health sector cannot take place without the active participation of patients. And when we see there is a lot of distrust, obviously, inside of the community according to data processing in the health sector, how can we ensure active participation for patients in the data processing?
Oh, thank you, Lutz. Yeah, I am very surprised of the results of the survey here, but it only shows the truth that there's still a lot of work to do to ensure patients that they should trust. But let's start from the beginning. On the beginning, I would like to introduce myself also and explain some things. Because probably there will be some questions on the chat. As has been mentioned, I was for 3 cadences the board member of the European Patients Forum. European Patients Forum, it's an independent non-governmental umbrella organization set up in 2003. Our vision is to all patients with chronic and long-term conditions in the EU have equitable access to quality, patient-centered health and social care. And our role is to ensure that patients' community drives policies and programs that affect patients' lives. When it comes to your question, how patients actively participate in data processing. I think I will not discover anything new if I will say that we patients play the very important, maybe even the most important role in this process. Patients are some kind of the key actors from the early stage, because nothing exists without the patient's participation in the health data process. Today, it's clear that patients' participation in decisions regarding health and genetics data processing is a matter of good governance. Patients' involvement is visible at the policy and program level on question of privacy in healthcare and the health research. As we observe for many years, there is an increasing drive to improve collections and use of patients' data in order to achieve better, more sustainable healthcare and advance health research. The only way to do this is in meaningful and valuable way is together with patients.
Yeah.
So empowering patients as owner of the health and genetic data to make decision about their personal information is crucial. If I may to take your around 1 minute more, I would like to tell you that a couple months ago, EPF has conducted the survey among the membership and among its membership and asked on the patient perspective on electronic health records. Of course, we don't have time now to analyze more deeply the results of this survey, but the results of this survey shows that on the first point, patients are generally comfortable of willing to share health data and recognize that this is the vital importance to advance the health research. What is very interesting, the most trusted environment is healthcare and research settings. Another thing is fact that patients are very open to teach each other and to help peers, generally community and peer support, and also to help the future generations.
This is
the data processing also is very helpful in looking for the solution to unmet needs. More open are patients who have lived through the experience of diagnosis and hospitalization. They have already experienced the benefits of research through therapy, of management of their diseases. And, patients learning from their own data.
Yeah,
how to manage their self-management and how to empowerment.
Yeah, this is quite interesting, especially in the context what Sonia Shaikh just mentioned in the in her statement, because when we think about the health data, in fact, provided, for example, also from the public, at that moment we have to include or consider that in the among the stakeholders there are competing interests, and at that moment I'm very much interested to ask or to know from Sonia Shaikh, from which perspective of a communication expert, from your perspective, what are the main interests of the stakeholders in the healthcare, and are there, as I at least can imagine, are there competing interests which are not always in favor or trustful for patients?
Yes, I think so. I'm going to answer this question assuming that we are talking about an EU-type healthcare system or an EU-adjacent healthcare system, which is largely subsidized by the state and mostly paid for by the taxpayer. And within such a system, although the biggest goal is to give maximum access to the publics, and to get them healthcare and on time, I think we forget often that there are various stakeholders which are working together and sometimes not together to make this goal happen. And what happens within this larger discussion is that we forget that these stakeholders, and namely the state, the pharmaceutical companies, the tech companies, and especially the insurance companies, they have competing interests. And one of the biggest interests that they all have, which is common to all but manifests differently for each of them, is to basically save money. And when they try and do that, each of them, they have differing motivations as to how to gather data, to process data, and utilize data. And within these circumstances, we forget the publics, which remain uninstitutional. They don't really have an institution. So their interests are obviously sidelined and ignored. So as within the communication setting, I think the biggest, if we have to think about competing interests, we have to think about information and knowledge silos, that the publics remain unaware of how these competing interests develop and evolve over time and how it's impacting the way their data are being processed. And I want to use the word publics instead of public because public assumes that there is an average person. But I don't want to assume that. I'm assuming that there are different groups with varying levels of access and competencies and freedoms, and each of their interests are potentially violated when we forget the competing interests of more powerful stakeholders.
Yeah, so what I understood is, in fact, that these stakeholders' interests creates a big challenge in data security, cybersecurity, and so on. And this is what I would like to ask at the beginning, Giuseppe Fico. What is the main challenge, according to your perspective, for the health sector in the context of data processing, cybersecurity, from the perspective of, from your perspective, and since you are leading an IT developer team from the perspective of an IT expert?
Well, thank you, Lutz, for the question. On top of IT expertise, I would also add the biomedical engineering layer, which is important from our perspective, because this does not only mean to train our experts, future experts and professionals on IT issues, but also on disciplines that are related with medicine. Therefore, better understanding of health and care elements and the clinical aspect and the medical aspect is fundamental, as well as human factors, but also life sciences. I'm going to tell you why. The topic of today is about data processing and the health sector, and we are talking about patients. We are mentioning, and we will mention most probably, the GDPR, but the new kid on the new elephant in the room is the European health data space. As we know, the European health data space is also an instrument, is a regulation that is trying to address gaps that the GDPR created, especially in the healthcare sector, and especially for primary and secondary usage of data, health data, to improve the health of our European citizens, but also the healthcare system and the European industry. In a nutshell, the European health data space is demanding for secure and protected environments. No? This is in a nutshell what the European health data space may be translated technically and technologically speaking for our IT expert. As you said in my describing what I'm doing, I'm managing several large-scale pilots in Europe about digital health. Tomorrow we have a project review, and I'm going to spoil some of the things we are going to mention tomorrow. We are doing a pilot with 50,000 users all over Europe, and we may be an interesting use case of European health data space as an implementation. And we are doing co-creation activities in living labs. So we are very aligned with the activities that European Patient Forum is doing. We are working with them in several projects, as a matter of fact, and we are trying to use a living lab approach to ask to our main beneficiaries, the citizens and the consumers of our solution, what we need to do in order to create trust. Well, we have discovered that secure and protected environment is not going to create trust to our citizens. What does this mean? It's not let's say that it is not a determinant for trust. What does this mean? It means that our IT expert and our professionals need to translate in another language the consequence of creating a secure and protected environment. So at the end, it's a matter of taxonomy and of understanding how to communicate to the different stakeholders the things that we are producing. This is the greatest challenge that we always have, you know, also because we are working together in several projects, and transferring the right message to the different professionals is the greatest challenge. So this is the greatest challenge that we have.
Yeah, thank you very much. And this leads me directly to Karl-Nikolaus Peifer. You said in your statement, if I understood it right, that the flexibility of GDPR about the public interest works quite well in the context of, in the system of the GDPR, but not during the transfer of data to third countries. So, and at that moment, I would like to know First of all, what is the flexibility of GDPR? And on the other side, why doesn't it work so well on the data transfer to third countries? So we have here lots of Turkish guests here, and Turkey is in fact somehow related to Europe GDPR. So what is in fact your understanding?
Yeah, thank you very much. I think I first have to give a short answer to what was said before. The flexibility, as I mentioned, as it exists in the GDPR, is that it leaves space, it leaves breathing room for new concepts. It's a regulation from 2018 and goes back to 2012. So when this data environment was constructed, nobody really knew what the applications would be. So despite everything that was said before, there isn't enough trust. There are competing interests. I understand this, but I still think that the GDPR as a regulation of principles of data use had to be sufficiently flexible, sufficiently open to uses and to competing interests, to see what happens on the floor, what happens in the market with data, what happens in the usages with data. So I think despite the critique that I've heard from the other speakers in this direction, I think it was a good idea to leave it open and leave some elements of movement in the system. So this is what I call flexibility. How does it work when it comes to the situation outside the European Union? Well, you know, the transfer of data in other jurisdictions apart from the European Union is quite heavily regulated. It's almost forbidden when it comes, for instance, to the United States of America, where all the great servers, all the great business models around the use of data lie. So there is, since the two Schrems decisions, we really have a problem in transferring data, which probably is directly in the sense of the GDPR, who wanted to create a standard, a gold standard, which will work worldwide. So don't be misunderstood. I think the Schrems decisions cut clear marks into the data protection landscape, even when it comes to the transfer of data. So, but you also listen by this that there is some inflexibility, and there is inflexibility in a system that has to work globally, thinking about apps, thinking about servers, thinking about data structures that heavily rely on international server structures. We see that this does not really work with the GDPR. We have a list of countries where we have adequacy decisions, which is more or less restricted to the European Union, and some other countries like Canada, Iceland, Norway, Switzerland, Japan, Korea is now on the list. Turkey, for instance, is missing, so there's no adequacy decision for Turkey. The most of Asia is missing. So if we want to have a worldwide global market of health uses, imagine that you're traveling abroad, then we need more standards in these countries. So this is still a task which has to be fulfilled.
Yeah, thank you very much. I have just in this context a question which before I want to complete the first round with Selda, I would like to ask. One of the guests asked, are there resources to help to identify if health apps in the Play Store are reputable? So when I understand the question in a way, so we have at that moment a system where GDPR doesn't work necessarily, since we are in fact communicating at that moment data with non-EU countries. What can you answer to this question?
So if I'm addressed, or no, Günes, Seldag, you were addressed, sorry.
No. In fact, I wanted to ask you first before I complete the question, because I just got this message.
Okay, thank you. Well, we have the list of adequacy decisions in the European Commission. I can send it around in the chat if you're interested. And then there was a review by the Mozilla Foundation about health apps, which was quite illustrative. Many of these health apps are European and some are German health apps. So I'm not aware whether they work in Turkey, but I can send you the link also in the chat so that you can control. There were about 40 health apps tested by the Mozilla Foundation. And the idea was to test them according to the GDPR standards. And a lot of these health apps failed.
Super. Thank you very much. Now to Seldag Günes Peschke. So it is in fact about your statement. You stated especially about the women issues in the context of COVID-19 pandemic. You mentioned in your statement that it was difficult to respond to specific needs of women and girls during the COVID-19 pandemic. And which kind of research or how can we better understand what is necessary so that we are better prepared related to the needs of women and girls in the next pandemic? You have to unmute yourself, please.
Thank you very much. Good evening, everybody. I'm very happy to be here with you tonight. Of course, for the empowerment of women, there's a need of gender response laws, policies, institutions to encourage women's participation in policy and agenda setting. The societies and communities should adopt attitudes and practices that advance gender equality and women's empowerment. The states should support equality and women's participation in decision making as well. A better knowledge and data should be generated, including more global statistics disaggregated by sex to inform gender equality strategies. A lack of sex disaggregated and broader gender data on the impacts of the pandemic has made it difficult to measure and respond to the specific needs of women and girls. We have observed it during the pandemic. This has contributed to the failure of many COVID-19 response and recovery plans to incorporate gender-sensitive policies. So what should be done when we ask this question? The main thing for the governments, for example, they can increase support to national statistics systems to facilitate the strengthening of gender data collection. They can invest in the collection and analysis of gender data to better understand and respond to the pandemic's gendered impacts, as well as to monitor the gendered impacts of COVID-19 relief efforts according to.
Yeah. Thank you very much. I would like to go now a little bit deeper first to the aspect of participation and public interest. And my first question is to Sonia Shaikh. You mentioned, so we had before this talk already some very interesting mail correspondences, and you wrote, in fact, that according to you, there are 6 main stakeholders in the health sector. No? So this is the state, first of all, then hospital and clinics, insurance companies, pharmaceutical and medical companies, technological companies, and of course the public. When we see these kind of stakeholder system, let's say, it fits a little bit to that what we use as a basic model in our PandeVITA project, and in fact, by the way, in many calls of the European Union, the quadruple helix collaboration. So it means, in fact, there is a need for collaborative activities among these stakeholders. Otherwise, we are not able to proceed sustainable innovation processes. No? And according to me, sustainable innovation processes is not only, let's say, limited on climate change and environmental issues. It's definitely also applicable to the health sector as well. When we think on the one hand side on the competing interest, how can we ensure that all stakeholders collaborate with each other and do not forget to listen to the public?
I think so I am not an expert in law, but I assume that the answer would something lie in that area. There has to be legislation which forces stakeholders to carve out or explicitly state their competing interests. And I know it sounds a bit idealistic, but I think it's possible. Because I think if you force stakeholders to list out what it is that they're after, it's much easier for different people to come to a collaborative standpoint. And I think one of the things that we have, like one of the issues that we have in policy or development is to be unable to understand what the other side wants. And I think to be able to do that, there has to be active legislation as well as perhaps third-party groups which can create a coalition of different stakeholders and give them opportunity to interact with each other so that their interests are visible. And I think it's important to think about how to make different interests visible. And this is something that will only evolve over time because interests change, and specifically because technological changes are happening so fast. We'll have to have a system or I don't want to use the word organization, but something like that, which can bring these people, different stakeholders together. But there has to be room in legislation where competing interests where stakeholders are almost forced to list their interests for consumption of everyone.
Yeah. And directly to Michal Rataj, the question in this context, but also I got a new question from the guests on the chat. Someone asked which stakeholders benefit most from the health data. So you, in fact, these are good news when I understood you right, that in fact there are the public, almost according to your perception, trust to these kind of data processing. But in fact, there is obviously somehow the question, is there not someone who gains more from that? Michal Rataj, how do you see it as a practitioner?
It's a very tricky thing because even when we are working very deeply on this level to convince patient to share the data, to work on the data, to find the benefits from it. There is still a problem to convince to find enough patients to be more open and to be more understand in this process. We are living in very difficult time now. The last 2 years for all of us were very difficult because of the pandemic. Because of the pandemic, the health issue has been raised on the top of the agenda of the everything. We heard about the health because the healthcare and health insurance is the most important thing in our life, and it builds the communities. It builds our future. So it means that health should be on the agenda of the everything. As we can see now after the pandemic, it's not such let's say optimistic as we were thinking that it will be. the number of the fake newses related to the healthcare, related to the health, the good behaviors, and so on, coming to us from different sources is it's very huge, and there is still a lot of work to do from many stakeholder sides to find a common language. And I just want to say by someone in the previous question that we need to find the common union, the common language, how to speak, how to translate the language coming from the researchers, from doctors, from the people of coming from the science, and to translate the easy language to the, let's say, people who are living in the rural areas, not in the big cities, and so on and so on. Currently, I can as well, there is an opinion that in many countries the healthcare systems and the healthcare solutions are created by people who are living in the center of the big cities. We are completely missing the people who are living in the rural areas and in the small villages and so on and so on.
Yeah.
So it might be the problem with the understanding to each other how to transfer the information.
This is an important point. Yeah, I think so too. Giuseppe Fico, your team is in fact also a part of the PandeVITA family, and you in fact are developing a platform to increase the citizen participation. You are in many Horizon projects involved, where in fact the participation of citizens in the health sector will be somehow investigated. What do you think? How do IT platforms like you develop, and what in fact the public can use, how does it support the public engagement processes in a positive way?
Thank you for this very interesting and maybe not fully answered question. It's a very important challenge, but let me take some elements that you have also discussed in these last minutes. You have been referring to the fact that PandeVITA is somehow synchronized with the quadruple helix model. Let me tell you that also in the healthcare sector, the quadruple helix model has been used in the last 10-15 years as a way to define reference sites in initiatives that is the European Innovation Partnership on Active and Healthy Aging. And in that context, almost all the region and municipalities in Europe have tried to define indicators that are relevant for the quadruple helix in order to define themselves as reference sites for innovating in the healthcare sector. Therefore, trying to understand the role of the stakeholders in this quadruple helix, well, now we are talking about the quintuple helix because now there is the sustainability and environmental pillar or helix, trying to understand how to define outcomes, objectives, and indicators, organizational process indicators that are relevant for each and every stakeholders is a fundamental exercise. Together with the expertise on social science and human-computer interaction is another important element that you have to take into account. Combining all of them in the design of dashboards with some business intelligence analytics and convince these decision makers of the thing that they have to do is another fundamental element and precondition in order to use these tools in an effective way for your users. So these are only the precondition.
Yeah.
But then understanding the context and try to understand the behavior of your users, plus engaging factors that can be serious game, can be behavioral theory, persuasive design, and other elements are another condition that you have to consider. And then testing, experimenting, and certifying the things that you are doing.
Yes,
these are some of the elements that are important, at least to not fail.
Yeah, I cannot agree more. And in fact, just to explain it to our audience, quadruple helix means, in fact, that 4 systems, or in quintuple helix 5 systems, have to collaborate. This is science, politics, economy, and the media-based public. And as a 5th system, what you already mentioned, it's the natural environment of societies, just to be clear. And in fact, let's have maybe a little bit a view back. In fact, luckily, at least, it looks like as if we can hope that the pandemic time will finish, at least in Germany, in the STIKO Commission of the Robert Koch Institute. They say, in fact, we are becoming epidemic now, and at least the health apps are not mandatory now. So it is, in fact, something what we can use voluntarily. In, for example, in Turkey, the so-called HIS code, which we all had to generate in the public life when we wanted to go shopping, or when we want to go travel and so on, is in fact not necessary anymore. The HIS code does not exist anymore. But in fact, here we can in fact see 2, let's say, competing approaches. So there are quite strictly regulated ways how to use these kind of apps, like it was proceeded in Turkey, and some situations, especially what I could observe in Germany. There are also the Luca app, when you wanted to enter to a pub, or for example, but it was much more liberal because of the voluntariness, what is understood as a high good. First, and I would like to ask our law professors here in this round. First, maybe Selda, how did you perceive the usage of the HIS code in Turkey according to these credo of voluntariness?
Thank you very much for the question. Normally the mobile applications are used, as you know, by the user voluntarily. So we don't see so often the mandatory use. But in the pandemic time, there was something in favor of the people, you can say, maybe in favor of the public interest or public health. There were some exceptional situations. The HIS code in Turkey, which was applied by the Ministry of Health, for example, was put in first voluntarily, as we see in all the applications in Europe as well. But in some cases, we see that it was a kind of obligatory, it turned into. Why? If we see, so each case should be identified clearly, because while going to a shopping mall, sometimes traveling, there were travel restrictions, as you know, in all Europe as well, or taking an appointment from a public place. The people who has HIS code could enter, they can take the appointment and go to this place, or in the shopping malls, they have to show these HIS codes. It is also discussed very much in Turkey in terms of the privacy regulations and data protection as well. So when we check the situation in Turkey also, as a third country, Turkey is not inside the GDPR, but we have, Turkey has also data protection regulations. And the last regulation which was enforced was 2016, but before also we see in our civil code there are regulations about the personality rights, the protection of the personality rights that are protected under 23, 24, 25th of the articles. Also in the Turkish constitution, article 20, in the third paragraph, there's a specific placement for the data protection. And also we see in the penal code as well, recording of the illegal recording of the data are punished heavily by the imprisonment as well. So when we consider all these regulations, and there are also some regulations, I don't want to say all of them here, but when we consider all of these, HES code was an exceptional situation. Why, if we take it into consideration? Because of the public health and public interest of the people, the ministry announced this HES code, but everybody had to download it in their telephones or in their computers. They have to take a HES code if they want to be kind of in the social life, if they want to continue their life. But if somebody stays at home, he doesn't go to the shopping mall, nothing to do with the public places, of course, at that moment, there is no need to download, or there is no need for a HES code. The situation was like this.
Thank you very much. Karl-Nikolaus Peifer, when we think from the, or start from the aspect of voluntariness, how, so, and we have a crisis situation, something, so certain unexpected events happens and so on, and in fact the decision process has to be extremely fast. Isn't voluntariness not something what avoids, in fact, certain processes, and how is it grounded in the or considered in the GDPR?
Yeah, Lutz, it's deplorable, but you're right. Voluntariness can be an obstacle, and it has been an obstacle in the pandemic situation in Germany as well. Despite being a country in which the GDPR is valid, and in which for health applications, for public security applications, exceptions from the voluntariness principle are licit. So voluntariness in a crisis is not the main goal. However, Germany was very keen on guaranteeing the voluntariness. So the data protection agencies always warned, don't bring too much force in the system. Let people decide. Let people decide what they want and what they don't want. So if you create this app, the Corona app that we had, the Luca app that we had, if you create these apps, make the principle of consent the top priority in this app. And that, of course, also led to the point that some people were hesitant, because what Michal said, that there isn't enough trust in the system, led to the fact that many people did not want to consent because they did not really see what exactly do I consent in, what is the information that I need, where do I get it? And then people were hesitant. So a very strong consent principle is at the heart of the GDPR, no doubt about that. But this strong consent principle can, in times of crisis, be also a hindrance. I hate to say that, because I love the principle of self-determination, and that everybody should decide for himself what he wants, what data he wants to spend, and what he doesn't want to spend. However, if you are uninformed, then the consent principle can be an obstacle to achieve a public health situation that we needed in that time.
Yeah, thank you very much. I would like to go a little bit more deeper in an understanding of data protection, and I directly would like to.
Lutz, may I interrupt you for
Yes,
a
of
moment
course,
only?
of course, please.
Because I was thinking about everything what we said before, and regarding also to my last answer, I think that I forget about the one, or maybe even one of the most important thing when it comes to the potential patients' involvement in this process. I forget to mention about the health literacy, which is crucial because we need to work on it. And for many of years now, we are doing many actions when it comes to improving the health literacy, including patients, because health literacy, health equity promoting, and reducing of health disparities. It's a very important thing, and it really helps to for better understanding the issue and the level of the issue. So,
yes, and I think I totally agree. Health literacy is something what we have to increase, most probably, or at least to create infrastructures which supports health literacy. And this is somehow, for example, there are many health applications, for example, which are in favor of that. But in fact, at that moment, we come always to the point back that we have to understand the data protection issues better. And in this context, I would like to start my next Mentimeter question. Max, if you could show us the instruction site once again. So please take your the QR code or write www.mentimeter.com and enter the code 13301872. So I see now the but we have still active users. This is great. And in fact, the question what I would like to ask is when we, for example, install a health app, not only the health app, but an app. At that moment, there are lots of questions which are asked according to the data protection policies, what you should agree, and so on. And it is really quite a lot. So, and if we show now the questions, what I want to know is how do you regard it? How much do you know about your rights regarding data protection and data processing in the context of mobile and digital apps? I have three options, enough to select mobile digital apps without any doubts, or data protection regulations are confusing and I feel concerned when I use mobile apps, or data protection regulations are confusing, but it has no impact on my decision to use a mobile app. What would you say? And I see so there is in fact a little majority who says the data protection regulations are confusing and the people feel concerned. And if of course I did not vote anything, but in fact for me it is nearly the same. So when we think about health literacy and we want to support people to use these kind of applications, how is it possible that we make the informations for data protection issues easier? Maybe another question to Karl-Nikolaus Peifer. Or is there a chance?
Well, to tell you the truth, I was choosing option 2 myself, So I think I know something about data protection rules, but still I'm concerned when using apps. So maybe this is because of the question can also be a bit confusing. Despite knowing about data regulation uses, you still don't know whether the apps comply with the regulations. So that is my main concern. I trust the data protection rules, but I don't trust the apps. So what is the problem with that? Informed consent, I was mentioning that earlier, calls for a trustful environment in which the information is presented easily, understandable, and quickly, and not in a confusing list of options. Michal was mentioning the people in the countryside who maybe use smartphones rarely or for the first time. Think of elderly people. They have no chance in understanding that system. So it's still too complicated, and we still need much more simplicity, but with an option of public interest authorities, maybe data protection agencies, maybe consumer protection agency, who control what is conferred to the consumer in these apps, who can give us signals of trust, like some medal of trust that is put to the app or whatever. So we don't need to care whenever we use these apps. And the GDPR is very complicated because it wants to have a strong protection. But with all this complicity, it is also hard to deal with for consumers.
Yeah, thank you. I would like to come back to GDPR once again, but of course now it's time to ask Sonia, as a communication expert, what is your idea? How do you understand this problem from the perspective of a communication?
I think all of these comments tie into the idea of information or knowledge silos. So what we have right now is that we have either perceptual or actual knowledge or information silos where only a few people have the capacity to access difficult information or about data or its usage and how it's processed. And one of the things to consider about breaking those information silos and maybe making it more accessible to publics of all kinds, like for people who live in the rural areas or people who are older, is to incorporate the elements from human-computer interaction and design, as Giuseppe mentioned, and create maybe a basic or more agreed upon standardized system, a platform, which should be able to allow patients, let's say within the EU system, access their health record without having to go through hoops. And I think what we have to do now, at least in different countries, that there are some places where you can easily access data, but in other places you have to ask your healthcare provider, and then they will redirect you through a portal. And in some cases, there are no portals. So there is no standardized system or format which makes it easier for publics of their various kinds and various digital competencies to access their information. So I think what we need to work on next step is to create an accessible portal or system which is as standardized, or has at least basic standardization available and informed by the designs and ideas which have already been developed in human-computer interaction, and they have been there for a very long time now, and they're very successful too. And I think that is a more logical next step, and we have the tools and the experts to make that happen.
Directly to Giuseppe, are there, so when we are in fact asking for or requesting applications, are there any best practice examples or in fact approaches where you would say in this direction we can go, that it works and that we support the health literacy in related with the struggle of the data protection manual, let's say?
Yes, in my opinion, I mean, I have been working in health literacy, patient empowerment, patient activation initiatives all over Europe. So also in these partnership on active and healthy aging that I was mentioning. And the most successful one have been when there was and there is a complete ecosystem behind activities that are related with the empowerment or health literacy. And with all the stakeholders, I mean all of them. I'm referring to large scale, to big companies, big industries, healthcare providers, and all other actors. So whenever there is a complete and comprehensive synchronization of all these actors, initiatives that are related with health literacy have worked better. So I have been in a project where we were focusing on diabetes and health literacy and empowerment, and was successful till a certain extent. The same project, years after, that included all the stakeholders, was a great success. So this is my opinion on it.
Okay, yeah, thank you. Karl-Nikolaus Peifer, I would like to come once back to the GDPR. In May 2022, the European Commission published a proposal for, it's called Regulation of the European Parliament and for the Council in the European Health Data Space. And directly at the beginning, it is written that uneven implementation and interpretation of the GDPR by member states creates considerable legal uncertainties. In fact, so just naive from my perspective, why is it so uncertain? Why is it so uneven? Why is it so difficult to create something what is in fact implemented and interpreted by all my member states in the same way?
Yeah, thank you, Lutz, because this is the flip side of my first answer in this panel tonight. My first answer was it's flexible. And this is an advantage because it leaves breathing space. That's what I said before. But it can also be a disadvantage because the more flexibility that it has, the less strictness it also has for the member states. So it's a general data protection regulation. The word general means this is only a framework. It's not a specific regulation regulating every aspect precisely for all the member states to just do copy and paste in their national legislation, which you wouldn't have to do because it's a regulation. But general means it leaves open clauses for the member states. And open clauses means that member states can also have a level of interpretation. And this level of interpretation, of course, was used when the GDPR was coming into action. So what are these interpretations? Let's speak about standards of data security, which aren't strictly ruled in the GDPR. So member states have a level of interpretation in this field. Then what is about, let's say, password security? What is a secure password? No rules on that. It's a general regulation. It's not a strict technical legislation. What is research? Is research only research in the public interest when it is financed by the public? Or can it also be research when it is financed by commercial entities together or alone? It can still be in the public interest, but if it has a commercial end, there might be other rules than if it is completely publicly financed. So these are some of the advanced examples that I can give you where we do not have strict rules. And when it comes to the new legislation that we now have, we see that the new legislation now picks up certain topics and tries to do more rigid regulation, more precise, more specific regulation in order to fill these gaps and to prevent member states from leaving too much variety on the European landscape.
I see. Yeah. So it really is a huge a topic, and this a compromise between flexibility and a huge range, or sometimes less or more huge range of interpretation. In fact, I was quite a lot of focused on a crisis situation. So what does it mean? What does a GDPR, what does voluntariness means in crisis situations? But in fact, I'm in my last block, in the last topic, what I would like to discuss a little bit is, so how is the situation in the context, the GDPR, or in fact, the situation of patient files. So when we have patient files, at that moment, we have to somehow follow this. In fact, there is in fact a need that we increase the control of the natural patients over their electronic health data. But is this really given? And I, first of all, before I start, in fact, with the statements of all of you, what I'm very much interested in, I would like to start another Mentimeter questions. This is in fact about the question, do you prefer an electronic or an analogous patient file? How is in fact your situation? What is in fact your opinion? Is it, do you have more control over your health data with help of an electronic file or with an analogous file? This is what I would like to know. Oh, it looks like this. So, of course, it is clear that the activities of the guest is a little bit reduced, and it is, of course, not a representative question. But in fact, we have here among the audience a tendency, the most would like to have an electronic patient file. Michal, how is it from your perspective? Does it fit, in fact, to your experience, what you have within the European patient forums or in all your activities?
Well, you know, it's again a very tricky question, because the answer, from my perspective, might be like. I should start from the sentence like a lawyer, you know. It means it depends. it depends of the many aspects. I am generally, for me, I totally agree, and I was voted on the electronic files because you know, if you want or not, we live in the very digital era currently. And we have to agree with the fact that if something related to healthcare is based on the digital way, it's definitely much easier to analyze. It helps to teach, for example, artificial intelligence. It helps to learn doctors, researchers, and so on and so on. And it's much easier to share data which are located in the, let's say, in the electronic type of base than in the paper. So it's a future. We need to agree on it. So
yeah,
if you want to agree on it, so it means that we want to stay on in the same level. If you want to, you know, change something for the better, we need to think that this solution gives us the possibilities.
Yeah, Yeah, according to me as well. But in fact, just for my person, in Turkey, we have already electronic patient files. So, and we can, in fact, have a look on with help of an app to all the results what we had in the past. And when I moved from Germany to Turkey several years ago, at that moment, it felt, and so I was not really concerned, but it was a strange situation. I uploaded the app and could see even my routine checks from 2014, all the blood values and so on, and when I've been ill and so on. It felt a little bit strange. So I felt a little bit, so I'm very transparent, and hopefully everybody, so nobody misused these data. This was in fact, but on the other side, I'm very happy to have that, because in Germany I always struggled, which general practitioners has my patient files now and so on, because luckily I'm very healthy and so on, therefore I forget which kind of doctor did I consult several years ago. So
you know what makes me very happy is fact that even if we don't have the officially information coming from the, let's say, for example, Ministry of Health, which gives the general practitioners, the healthcare places, the information, the strict information that the documentation and the health files should be saved on the electronic way. There is still the possibility, especially when you have the contact with the younger generation of researchers and doctors, you can do your own documentation and send to them by in the electronic way. So that's it's a beginning of some changes. So.
Yeah, thank you for your statement. I would like to continue now with final statements, and I would like to know from all of you what you think about this topic, especially in the context, how can we reach the goal that natural persons get increased control over their electronic health data? I would like to start with Karl-Nikolaus Peifer.
That's a difficult question, and it's an easy question. It's easy because that is what the GDPR wanted. That's what our data protection regulations wanted to achieve. Trust, confidence, information. So everybody knows what is stored about him, and everybody has the chance to decide whether or not he wants to spend this data. What is missing? The trust is missing, the simplicity is missing, and the execution of laws is missing. So it's still a complicated, regulated system which lacks trust. So trust would be my answer.
Thank you very much. Giuseppe, I would like to have your final statement now.
Thank you. Well, in this case, I would take an inverse approach. So not focusing on electronic healthcare records, but rather the opposite. I think Michal said before, we are in the digital era. This means that we are already in a digital era as consumer and less than as patients. Therefore, maybe it's through the consumer sector that we have to enter, and don't be scared of doing that in health. And I think that consumer and massive apps are already digitizing ourselves. So it's the time of for using these levers for health.
Thank you.
We don't have to be scared about that.
Thank you. Selda?
Yes, I agree with Karl-Nikolaus Peifer. Trust is very important, of course, but also, according to me, in every around the world, in every country, they have their own data protection regulations. For that reason, maybe there can be a program, global program for the data protection. This can be done. And the other thing is also this maybe a problem in EU, the regulations are always in English or French, mainly they are discussed. But each country has its own language. So while translating these words, there can be some differences, missing things also. For example, in one language, there is the meanings can differ, can change. For that reason, a common language can be used for the regulations, especially EU and the related regulations as well, according to me, and the global program can be created.
Thank you.
Thank you.
Sonia Shaikh.
I think if you're talking about giving people the chance to have increased control over their data, control is only possible if you're able to see and access your data. And for that to happen, I think the most practical solution is to use digital tools or where data is stored and people can access it freely. And obviously, and I mentioned this before, I think there has to be some kind of standardized digital tool across the EU, which obviously can be tweaked and customized to local needs and contexts. So I understand that. But there has to be a basic digital tool which allows people to access their data freely and be able to tweak it and modify it and have and practice the right to be forgotten if they want. So there has to be a digital tool for a control to be exercised, or else these things are just hypotheticals.
Yeah. Thank you very much for this really interesting and enjoyable talk. I was very happy to have you here, Michal Rataj, Sonia Shaikh, Giuseppe Fico, Seldag Günes Peschke, and Karl-Nikolaus Peifer. It was, according to me, really, we have more insights now in the different kind of topics from the different kind of perspectives, which is all related with data processing. And thank you very much for all the guests for your coming. I wish you all a pleasant evening, and hopefully we see us in next spring again when we have the second PandeVITA video talk. Thank you very much again, and goodbye.